Now we have to mark the next of the questions as per these guidelines, and the guidelines are: if both assertion and reason are true and the reason is the correct explanation of the assertion, then mark 1. Then second, if both assertion and reason are true but the reason is not the correct explanation of the assertion, then mark 2. Third, if assertion is true statement but reason is false, then mark 3. Fourth, if both assertion and reason are false statements, then mark 4. And as per these guidelines, we'll mark the rest of the questions. Now, question number 171, assertion given is parthenogenesis does not involve syngamy, and this is a true statement. Parthenogenesis does not involve syngamy. Syngamy means fusion of gametes. There is no fusion of gametes occurring in parthenogenesis. The reason given is in parthenogenesis, development of an organism occurs from fertilized gamete, and this is an incorrect statement because in parthenogenesis, development of an organism occurs from unfertilized eggs. So the given reason is false, but as the assertion is a true statement, so we can mark the answer as 3. Let's discuss our next question. Question number 172, assertion given is sometimes doctors inject pitocin to facilitate delivery, and this is a correct statement. Pitocin is artificially synthesized oxytocin that aids in parturition. So sometimes doctors inject this pitocin to facilitate delivery or parturition. The reason given is strong uterine contractions have to be induced by injecting oxytocin during parturition, resulting in expulsion of baby. And this is also a correct statement. And as this reason correctly explains the above given assertion, so we can mark it as 1. Because oxytocin is released during parturition or during childbirth, which helps in uterine contractions to induce labor pain for delivery of child. Now let's discuss our next question. Question number 173, assertion given is lipase loop is an effective contraceptive measure used by females, and this is a correct statement. Lipase loop is a non-medicated intrauterine device. It's a non-medicated intrauterine device and is an effective contraceptive measure used by females. Now the reason given is it is a barrier method of contraception which prevents deposition of sperms into vagina of the females, and this is an incorrect statement because lipase loop is not a barrier method, but it is a device which is inserted in uterus for its activity with the help of a doctor or trained nurse. So as the reason given is a false statement, but the above given assertion is a correct statement, so we can mark it as 3. Now let's discuss our next question. Question number 174, assertion given is an example of evolution by anthropogenic action is industrial melanism, and this is a correct statement because industrial melanism, which is an example of natural selection also, is an example of evolution, anthropogenic action. Now the reason given is white colored moths did not adapt better after industrialization in comparison to Biston carbonaria, and this is also a correct statement because before industrialization there was no significant pollution and there was a lesser number of dark winged moths, that is Biston carbonaria, in comparison to white colored or light variety of moths which are Biston betullaria. And after industrialization, white colored moths or light variety of moths, that is Biston betullaria, were less adaptive in comparison to dark winged moths called Biston carbonaria. So this is also a correct statement, but as the given reason is not a correct explanation for the above given assertion, so we can mark the answer as 2. Let's discuss our next question. Question number 175, assertion given is under normal physiological conditions, every 100 ml of arterial blood carries nearly 20 ml of oxygen to tissues, and this is a correct statement because under normal physiological conditions every 100 ml of oxygenated or arterial blood carries nearly 20 ml of oxygen to tissues. Now the reason given is because nearly 15 grams of hemoglobin is present per 100 ml of blood. This is also a correct statement, but this reason is not a correct explanation for the above given assertion, because under physiological conditions, every 100 ml of arterial blood carries 20 ml of oxygen to tissues, because the oxygen carrying molecule called hemoglobin or Hb binds 1.34 ml of oxygen per 1 gram, and total amount of hemoglobin present in 100 ml of blood is nearly 15 gram. So total hemoglobin will carry near about 20 ml of oxygen per 100 ml of arterial blood under normal physiological conditions. So as the given reason is not a correct explanation of the above given assertion, so we can mark the answer as 2. Now let's discuss our next question.